Next item is approval of agreement with the Healthy Minds Policy Initiative for Phase 3 of the Mental Health System Assessment for the City of Edmond for $175,000. We actually will be using ARPA funds for this event. Christy, you're going to give us some presentation.
Good evening. I'm Christy Batterson, the Housing and Community Development Manager for the City of Edmond. On behalf of Chief Younger and I, we would like to recommend that we move forward with Healthy Minds to help us implement our plan that was before you back in September of last year, including the community stakeholder group. We felt that we needed to take the next step in implementing and going into action with the community partners in Edmond. So I'm not going to steal Jessica Hawkins' thunder here. She has a presentation to give you on the Phase 3 of our proposal.
Hey.
Hi there.
Good evening. Thank you, Mayor and council members, for allowing us to come back and continue this conversation about mental health in Edmond. Let's see, let me move this forward or not. Okay. Very good. So as a brief reminder, I'm Jessica Hawkins. I'm a resident of Edmond and excited to be here and be part of this collaborative. Was part of helping develop the report as a resident and formally at the State Department of Mental Health and Substance Abuse Services, and I'm delighted to be here now to see this move forward in our community. But I currently work with Healthy Minds. We are a nonprofit partner think tank around mental health in Oklahoma and have focused almost entirely on producing original pieces of research, publications, policy, and other work supporting big systems like hospital systems, school districts, communities in implementing best practices for mental health. So just as a reminder, we've completed 2 phases of work here in Edmond. First was Phase 1, a mental health system assessment, guided by the Edmonds Community Mental Health Workgroup and over 50 stakeholders from the community, from schools, from faith, from people with lived experience, family members, mental health providers and hospital systems. I could go on, of partners that helped the community in this phase really assess the status of mental health in Edmond and what is needed going forward. Healthy Minds conducted focus groups, stakeholder interviews, and completed a significant amount of data analysis to get to some key findings in this report. Phase 2, we worked with many stakeholders to then finalize a report for you, which you all had a presentation on, included about 27 action items presented in September. So the assessment of key findings, we had 3 main overarching findings. As you heard, there were dozens of various recommendations for the community to act upon, but overall, we found that in Edmond, access to behavioral health services does still have multiple barriers, especially for certain populations, such as young people, children, and their families. Some of these barriers include a lack of availability of a full array of local service providers, which we are very pleased to now have NorthCare as an intimate partner in Edmond, providing a large array of mental health services, and are very excited as part of this next phase to support NorthCare and building out that continuum of services in the community. Another key finding was specific to children and youth with behavioral health conditions in Edmond who are especially vulnerable to barriers to access, and also stigma. A major theme throughout the report was the need to work with the community and educate different organizations and community residents about mental health and how they can support one another and support this plan going forward. Just to highlight, we won't spend a lot of time here, but as a reminder in the report as part of the data analysis, we actually saw that in any given year, it's estimated that more than 10,000 adults in Edmond are living with a serious mental illness and or a substance use disorder. And when we speak about children, we know about 10% of children in Edmond have serious emotional disturbance. And in this case, these are our residents and our community members and our families and our friends who are suffering with some of the most complex mental health challenges and therefore need access to a large array of services. So some of the key recommendations in the report was to educate the broader community about the strategic plan and to engage them in supporting implementation. We want to help really support the successful CCBHC model that NorthCare is bringing to Edmond. It's a fantastic asset as a result of a lot of work writing grants, trying to get funding into the community, and NorthCare and the city's leadership to bring this service to Edmond. We want to make sure that this is implemented well and that the systems worked as they're designed for the community. Also, community crisis coordination. Edmond has wonderful resources when it comes to responding to mental health crisis in many communities, including Edmond. It's important that all of those services are well coordinated, that all the right agreements are in place, and that people who are experiencing mental health crisis get what they need as quickly as possible. Expand the capacity of local providers for prevention and increase student access to mental health services in schools here in Edmond. So for our phase 3, what we'll do is quickly work towards getting a teaming structure in place, some sort of governance structure to make sure that all of the key findings in the plan are activated and all the right partners are around the table. Number 2, we'll also be prioritizing all of those action items that were in the plan. We need to make sure that we start with our most ready pieces of the plan, which include making sure that your new CCBHC system gets up and going well and your crisis services begin to roll well with NorthCare. Also, a resource development plan will be important to make sure that Edmond in the long term can sustain these services and make sure you have funding from federal grants and state and local sources to make sure your mental health system stays a leader in the state. Healthy Minds also with phase 3 will help support Edmond in evaluating and reporting back to the city and to the community about progress that's made with implementing your plan. And also you'll have access to an array of subject matter experts in mental health through Healthy Minds and through the state and others in consulting with your group to make sure the plan is implemented well. So thank you again for your partnership, and I'd be glad to take any questions if you have any.
Council, any additional questions, comments?
Thank you.
Thank you very much.
I just wanted to mention that we are recommending that we use ARPA funds. If you remember, you designated ARPA funds for the first phase and second phase, so we'd like to continue that momentum. It's an eligible expense with using ARPA funds.
Say it. Well, I'll say something for the chief. I remember we've had a conversation about this as our next step forward, and this will help the community after we get established. Find the right door to knock on. That's one of the things that we found out in our mental behavioral health. As a community, we didn't know what door to knock on. Who can provide us that help? And this is another step in finding that out.